Okay, we're going to get started. So, welcome everybody. Thanks for joining us tonight. I'm Kristen Hopper, the Executive Director for BCOD. And tonight we're super excited to have Veronica Cabasa joining us. She's the founder and CEO of VC Advocate Consulting. And today she's going to talk to us about the human side of prior authorizations. Before we get started, I just want to tell you a little bit about the BCOD conference coming up. So it's if you haven't seen it already, you should be getting emails from us, but if not, please reach out to contact@bcofdermatology.com. But our conference is coming up, so we still have a little bit of time. It's November 6th to 8th in Fort Lauderdale, the Omni. It's a brand new hotel. It's absolutely beautiful. Just for $49, you get access to all sessions, lunches, receptions, breakfast. So it's an amazing deal. I mean, I don't know what you can do for $49 anywhere else and get all that. So we're excited to bring that to you. And if you register and book in the BCOD block by October 2nd, you get a nightly rate of $205 a night. So it's normally $275. So that's a great deal. And I think the rooms outside the block are much, much higher than that. So take advantage of that discount. And then there are some support tools for you all to leverage if you need to. There's a manager approval kit that helps you have that conversation with your manager. We have scholarship programs, so go on to our website for Veronica, we're seeing your email again. So go back over to your presentation. But
Oh,
I can just talk to it. So we have a
there we
scholarship
go.
application. Yep, we can see it now. Thank you so much. We have a scholarship application. It closes at the end of this month, so make sure to go on to bcofdermatology.com and register to enter for one of those scholarships if that's something that could benefit you. And then if you have multiple people in a practice that want to attend, just reach out as well. There's information on the website so that you can request a discount for multiple people. And then attending, for those of you who haven't attended or those of you who have, I see both on the call, you're going to learn things that you can implement right away. You're going to make connections with people who do what you do every day. You're going to get updates straight from the horse's mouth from some of the drug companies and get some insight on the programs that help you and help your patients. So make sure that you come and join us. We love it. It's a highlight of the year, and you're gonna walk away with some things you can implement right away. With that being said, I want to hand it over to Veronica, who's going to teach us all about the human side of prior authorizations. And what's really exciting is Veronica is going to be speaking at the conference too. So make sure you register if you haven't already. All right,
Thank you.
Veronica.
Thank you. Hello, everyone. This is my first time doing a webinar. I do this on offices, directly on offices. I'm a founder for VC Bio Advocate, and thank you. And I go to a lot of conference and I go to a lot of meetings. And one of the conference that I went to not too long ago, it came to my attention that some of the persons that were doing the presentation, they were saying that they do not answer patients' phone calls. And that was something that kind of triggered me, because if we don't answer phone calls to our patients waiting for the medications, how do we communicate, right? And that was something that I brought to my attention, because I was like, where's the human part? Where is the patients? How are we gonna communicate? And that's the thing that we already know about biologics and all these medications. We already know about the ICD-10, the BSA, and all this great stuff. So now I want to talk about the human part. Where is the communication with the patient, correct? So tonight, this is what I want to talk about, because sometimes we think that prior authorization is just a paper. I see it as a patient waiting, like we have to wait as well. So who's involved is everybody. It's the biologics coordinator, the nurse, the doctor. We all involved, the specialty pharmacy, and all that great stuff. So what I do when I go to these offices to help, by the way, I don't work in the office anymore. And this is how I came up with the idea to create the VC Bio Advocate, to help people, because I kept getting calls, the same patients of my office saying, I don't have my medication, with my medication. And when I go to these offices, the MAs, they don't have the time, which I understand, because they on the floor all day. And at the end of the day, we all want to go home. So they don't have the time. And this is a lot of follow up. So when I created my company, then I started going to these offices, and this is what I do now. I help the offices to get the things approved. And sometimes we make this, it's just little mistakes. We don't communicate. Like when I work in an office, it's very important for me to have that relationship with the providers, because providers, they just see patients. We behind the scene are the ones that we kind of finalize their notes with them, because we need to put the right note for the insurance, right? Is everybody listening? Everybody's so quiet. Are we there?
I'm here. I just have mine muted.
Oh, okay, okay. So, because I hear like a noise on my end. Okay, so this is one thing that I would like to say is that when we do our forms, is just we have to make sure we got the right ICD-10, and we have the right, which we know all this now. When a patient call, before a patient leaves, I always say this takes time because it's a lot of back and forth. This takes time. It's not going to be for tomorrow. But once I get that blood work, what I do is I put the patients on samples, because I know they're going to get denied. It's the first time they're getting their biologics. Once I know that denial is coming, but I already have them in treatment. And when I'm going to do the appeal, I already have them in treatment. So I have new notes saying that they are improving. Of course, with the topical creams that we give them and all that good stuff. And that's how I start my process with that patient. But I communicate all the time with the patient. And this is something that I see is a lack in every office that I go, no communication. And then the patient get frustrated. This patient is not sleeping well. This patient is itching, is getting worse, and all that. So this is why we get samples in our offices. This is why we have this relationship with reps. And we have, to me, it's very important to have a relationship with the FRMs. That's more important to me, FRMs, because they make it happen with us together. See, reps are great for coffee, but our FRMs is the one that we have to know who's the FRM, because this is the people that we're going to work with, right? So meanwhile, while I'm creating all this, I am calling the patient and telling them where we at. Sometimes I get the patients involved. If I'm with the insurance company, I get them involved too, because if they call, I call, we get results. But I always communicate. So this is the thing that I want to bring up, is where is the human part of the prior authorizations with the patients? Like why we don't communicate with them? Because they get frustrated. I don't get my medication, I get frustrated too. So it's very important for us to communicate with the patient. They need to know where they're standing. Even though if they don't have the great insurance, we can always still call and say what could be approved. And we take it from there. And if it didn't work, well, we try and fail this. Sometimes the office note says, our patients try and fail certain topical creams, and but which ones? How long? If we very specific, we get an approval faster, because then we're going to be with this back and forth. Like, what did they try and fail? How long? And because some insurances get a little difficult. So what I try to do is do it right from the get go, do it right, and make sure. Sorry, make sure that when I just try to not get a denial. But if I do, right away, I just read right away why they got denied right away. Sometimes because they didn't try and fail first medication that they have on, but probably that's not what the doctor wants. So we do a medical necessity letter. But meanwhile, the patient is getting treated. They coming back in 4 weeks to get another injection. I already have new notes for the insurance, and we take it from there. We get these patient approved. So this is one of the things that I wanted to talk to you guys about where is the human part of the patients, do that extra mile. To me, it's very important to get the patients treated. And I can tell you a bunch of stories that I have in my office. I did it for 15 years in that same place. and I create a great relationship with patients, and I make sure that they happy, that they being treated. And everybody's important, but us women, we like to look good and we like to dress nice for the summer. Some of them can't because they have psoriasis or they have other condition in their skin. So to me, it's very important to see this woman looking great for the summer. So I work with them to make sure that they are being in treatment. So this is the human side. I care. I care for these patients. So I would like all these offices to think the same way, which I understand that it's a lot of work being all day with a doctor on the floor. And like I said before, we want to go home. But where and when is that we're going to advocate with these patients? And these patients are calling, where's my medication? This is why I always have my fridge full of samples, because I want to treat these patients. And I fight the insurance and I get them approved. And if they have to see an infectious disease doctor or follow up 2 or 3 days later, listen, did you do your appointment for your, yes, I kind of babysit a little bit, but I make sure you know, they getting treated. So that was my for today. Anybody have any questions? Any questions?
Let's see, can everyone, I don't know if everyone's able to unmute themselves yet. Let's take a look. Give everyone some time.
Yeah.
Oh, it's on.
No question, but I just want to say thank you, and you make a great point. I try to tell my offices the same thing all the time. The BCs and stuff that I have under me, like we have to create those relationships. And even if you're calling just to tell them we're still waiting, give them that satisfaction of knowing that they're not forgotten about.
That is correct. That is correct. Like I don't work in my office. I still call it my office, but I see them because I work for a pharmacy and I visit all these offices every day. And when I go to my office and hey, was my patient's medication? Veronica, you babysit this patient's too much and da da da. So what? We have samples. Give them samples until you can get to it. Keep the patient treated. So it's very important to have that communication with the provider. If you work hand to hand with the provider, tell them don't finalize until I go through through the notes, because you can add stuff to it. Like you can add the try and fail. You can add so many things to it. Like if they come from another doctor and they were approved and now we seeing them new, or if they change insurance and they were previously approved, we can put all that together and just send it in one hand and get this approval done. It's very important to get this approval. These patients needs to be treated. I mean, the medication is out there. All we got to do is to write notes and get it approved. Get this patient in treatment. And if they have to wait a little bit extra, give them a sample. This is why we get samples. Sometimes I had a fireman calling me the other day, Veronica, I haven't been in my injection for a month and a half. This man have to put all this fire equipment on with psoriasis. He's miserable in that whole uniform. So I'm like, no, you don't have to do this. So I call the office and I say, go pick up a sample until she can get it together. And and I go help a little bit and so on. So let's help the patient. Like I see that a lot of these offices, like, I don't want to say they don't care or they don't have the time or they just, I don't understand what it is that why you stopping this patient from treatment and the medications in the fridge.
I
Help
know,
her
it's so
until you can get it
frustrating. I feel like
together.
offices get overwhelmed and they're overworked and patients get overwhelmed too. And it gets to be, I think a lot of insurance companies as well lose sight of like what you're saying, Veronica, like the patient is a person and they're a person that needs treatment, and however how they get treatment doesn't matter as long as they're getting what they need. And I think it's hard to I think it's easy to lose sight of that when there's so much going on in the world around us.
It is, and then we have the bridge program, we have Hub, we have the copay. I mean, it's a lot of way to get these patients on treatment until the insurance approve them. So why we don't try to do that extra mile for
Webinar.
these patients and get them on treatment? This is something that I just can't understand. It's really nice to go in a conference and get a microphone and talk of this beautiful thing, but what are you doing for these patients to get these medications? This is the main thing. This is why I created my company, and I did a V-Care a method, which is verify,
It's a nice one.
collaborate, advocate, and expedite. It's V-Care. This is something we have to do for the patient. To me, I come home very, very happy when I have a lot of approval during the day. I don't get them all approved the same day because, of course, it's impossible. But I have them on my list, and every day I go out there to make sure these patients getting approved or on samples or in Bridge or in Hub or something. They got to be in treatment. It's really hard. I have family on my own that aren't they have psoriasis, and I see the struggle and the itching and the skin and just the way it looks. And I work hard for these people to get approved. And I would love like a lot of other people do the same, but they just like, oh, just don't pick up the phone or don't answer. No, you don't do that. You have to answer these phone calls, and you got to tell them where you are. And you have to make them work with you. Like, do me a favor, call for me and do this, and you do your part too. And we work together and we get it approved. So this is something I really wanted to bring to this webinar, because this is something that I see every day.
It's not a question, Veronica, but it goes by what, and I can't remember who said it first, but it's nice to hear this type of webinar, because this is what I do all day long as a BC, is the prior auth and calling patients and keeping them informed of what their prior auth is, and doing the appeal and dealing with the denial and arguing with the insurance company on why the patient needs this, or why the patient needs this medication, or why they need this biologic, or writing the letter for medical necessity on why they need it and why the provider went this way or that way for this biologic and everything. So I just appreciate hearing another person's side of doing the prior auth and everything, because this is what I do all day long. And I have to remind the MAs that I work with of, hey, make sure you put this, and this, put this BSA in there, put this itch score in there, because in the long run, it's going to help me when I have to go back to the insurance company and say, yes, they need this. Yes, this is their BSA. This is what it is before they start the medication. This is what it is 6 months later when they've been on the medication. This is what they've tried and failed and everything else.
And another thing is that's a great point, because they just put a patient try and fail topical steroids. Which ones?
Yeah, exactly.
Be specific, like try triamcinolone, try clobetasol. How long? Just create that necessity.
Yeah.
Better.
And I have told them multiple times, please ask the patient. And I've gotten to the point now of where I'll even go in, or I'll pull a patient into my office and be like, look, I need to know, does it affect you when you're working? What do you do for work? What do you do for this? What do how are you sleeping at night? Is it waking you up and everything else? And they're like, well, why? And I'm like, because in the long run, if I have to write a letter of medical necessity, I need to know all this, because it's going to help us win in the long run with the insurance company.
Exactly. And
they're like, really? And I'm like, yeah.
You don't have to be with this back and forth, sending papers, waiting another week. And when it comes, sometimes you with a patient for 3 months to get them approved. Like, why?
Yeah.
Right from the start, from the beginning, it's not going to take a day, but it's not going to take a month.
Exactly.
Something will come back to us. And this is how, right away, when I get that form and I get that blood work, right away, I do everything from A to Z to make sure I do not get a denial, which I know sometimes I am going to get it, but I already know I'm up here with this patient's chart, and I'm going to fight you, and you're going to prove them, because everything you need is here. So Not if I got to do a peer to peer, trust me, I'll do a peer to peer with the doctor. At 12 o'clock, a peer to peer with the doctor. But this
Yeah.
person's gonna get. I mean, have the insurance, has what you need. So why not get them approved? And I
Yep.
fight these patients. I got to tell you, I fight for these patients a lot every day, and I love it. I love what I do. I love what
Yeah.
I see a hand.
That's me.
Hi, Stephanie.
Hi. This is Sarah out of Sarasota, Florida. I was curious if anybody, I have experience in our office using Castle Biosciences for atopic markers to see which drugs the patients are best suited for, and including that with a medical necessity letter. And I didn't know if any other offices also used Castle yet for the AD decision test for atopic.
You know what, in my offices that I've been, they that are not using that bio. So I don't know if somebody else can help me with this question.
If anybody has any interest in it, if you're using Castle Biosciences for the melanoma screening or the squamous cell test, they're doing a pilot group. And essentially what it is a scrape test that the provider does, and it shows whether or not they're more responsive to a TIC2 medication or say an IL-13 medication. So that way you have justification to show for atopic patients, hey, they don't respond to this class, so we can go to this class instead.
I
Yeah,
love
we heard
that.
about it
Oh,
and
okay.
we heard about it from our Castle rep, but I don't think our doctors are doing it yet. I know they're just doing it for melanomas.
I've heard of it, but
What
I do
is it
not.
covered? Like, is it something that it gets billed back to the patient's insurance, or how does that process work?
So it gets billed to their insurance. They accept what the insurance pays, and the patient has no responsibility for the cost of the test itself. And
Hmm.
then we get a report back. So like I did an appeal for a Sabinco patient. He had tried and failed Dupixent, Nemluvio, Ebglyss, pretty much everything. And so we had tried him on Sabinco once before, but considered him a failure because he wasn't responding at 3 months. But it took longer for him to be a responder. So then we put him back on therapy because we had the justification from the Castle test.
Oh, wow. That's
Hmm.
really cool.
Yeah.
I like that.
Yeah. So if anybody has questions, I can I have pamphlets that I can share. Just shoot me an email. I'll put it in the chat and I can send it out to you guys.
Yeah, yeah. Please send it over because I want to share with all the members too. If we can highlight it on the
Yeah.
BCOD site, that would be awesome.
Yeah, totally. I can PDF it and send it over.
Yeah, that would be great, Sarah. I'd love that.
Yep, that is good. Another about Dupixent, that's another thing is that, the patients, a lot of the patients get that dry eye. I don't know if you guys seen it,
Yes, I
but
have
I
seen that
always
with a
tell
couple
my
of my patients.
So what I always tell my patient is to buy the eye drops over the counter and just put eye drops because for some reason they get very dry. Not all of them, but some, yes, they do. And they right away want to take them out of the drug because they fail it. It's just dry eye. Get some drops. And let's keep having the patient in treatment. Then we want to start all over and put them on another medication. And it's just, I feel like sometimes it's like a lack of communication with the patient, the provider. I don't know.
Something that I started doing in my office that I found to be really helpful is when I get a new start or a change of therapy, is doing a welcome call for the patient in the beginning and doing like an overview as to what to expect for the workflow to be. And we utilize Clara, which is part of ModMed for texting. And I'll send them the biologics handout that we have. and I'll let them know to go ahead and program the hub and then the specialty pharmacy that we contract with, which is Sendera. So that way they have all of the contact information, and then I give them updates throughout the workflow.
I use Sendera too.
Sundara is amazing.
They are helpful. They are helpful. And now a lot of these pharmacies, they're using the Tandem, which is a great tool, but I feel like for biologics, you need that live person, because a lot of these people, they call and they have a machine answering them, and it's a lot. It's a lot. And the most sad part of it is that these patients are not getting communications, direct communication.
Agreed.
And then they start calling and they aggravate and they upset, and there's so many stories behind it. Like, I think every patient needs to be treated like if you going in an office and the way they want you to treat you, this is the way I treat them. So to me, it's very
I
important.
100% agree with that.
Communication is so important. Like even with the providers, I always tell the providers, do not finalize your notes until I see. And then I go through the patient's chart. I call the patient, have you tried any other medication? And, take it from there and keep writing. And then I do all the notes. And then with the doctor, of course, they got to finalize. That's the way I make it my work way easier, because I don't have to be doing addendum and attaching and sending, and it's crazy if you don't do that, you don't do that extra mile. To me, it's so important, that extra mile, and have these patients on treatment. It's horrible, all night with that itching all night, and you have a medication out there and nobody's doing anything for it. It's bad.
One
Yeah,
of
I
the
agree.
hard,
I definitely feel like the patients appreciate when you call them. Like Brandy said, even if you call them and tell them like you haven't heard anything back from insurance and you're still waiting, just that outreach, that just like you said, that extra mile of just saying, "Hey, I'm here. I'm working for you. I'm trying to get through this frustration with you." Just having that listening ear is so helpful for patients and for providers and everyone involved in the whole office.
Even for Medicare and Medicaid patients, especially Medicare, it gets very difficult. They can call, if they on Social Security, they can call there and they have funds for these people that can't afford it. And sometimes when that copay card is done, we already know by November that copay card is already done. I just sampled these patients until January comes and kicks in, and keep them in treatment. It's just work. We just got to work for these patients, and these offices needs to work. I came from an office today. I came back home like at 1 o'clock. I was early in the office, and the lady just told me, "Ron, I cannot see you today." And I had like 4 cases in that same office. And it's hard. They make it hard. And I say, that's fine. Well, tell me when can I come? And we gotta have these patients treated. I just can't see you today. No problem, but when? And then I don't leave without that when, because I need to know. Yeah. So it was really nice, this webinar. Thank you, Amy. Hi, Amy. Sarah, hello. Brooke. Amy, you
Yeah,
remember?
thank you, Veronica. This was an awesome conversation.
This was really good.
Thank you. Thank you. So what else? Any questions?
no, I thought the chat tonight was very thorough, very helpful. Thank you.
Thank you. Okay, so I think we're done.
Yeah, thanks, ladies. Thanks for joining. And gentlemen, if any gentlemen join the call as well, we appreciate it. We should have our next one next month, so register and we'll see you then.
All right, thank you. Have a good night, ladies. See you in the BCOD.
Sounds
Yeah, see
great.
you in November as well.
See you in November.
Bye-bye. Good night.
Bye.
Bye.
Bye.